This is Stephen Welsh, President of the International Chiropractors Association, with the Daily Message for Wednesday, June the 10th. Well, are you beginning to recognize that sometimes the so-called experts may have an agenda? Well, today we're going to look at yet another recommendation made by those experts, a recommendation that is still affecting most of our daily lives. Now, my question for you today is, why are so many people actually terrified and fearful now that we have so much more actual data and have a little bit better understanding of this virus? Well, perhaps it is because of the so-called experts that told us that an asymptomatic person, not even knowing they were infected, could transmit the virus to their immediate contacts. What could be more terrifying than a silent killer being spread by individuals you meet on the street that appear to be perfectly normal? Well, let's take a peek at the headlines that the public has been reading over the past couple of months. How about this one? As many as 80% of the people with COVID-19 aren't even aware they have the virus. And this allows the novel coronavirus to spread more rapidly throughout a community. Or how about experts? There's that phrase. Experts say that face masks are even more important now because of the number of asymptomatic carriers who are in public. Now, couldn't you say that the widespread requirement to use a face mask in public is symbolic of the fear that has been spread by the experts? Well, just last week, the New England Journal of Medicine even published an editorial entitled Asymptomatic Transmission, the Achilles heel of current strategies to control COVID-19. Well, based upon the opinion of a few experts, what did the CDC do? Well, the CDC recommended key interventions, including physical distancing, using of cloth face coverings in public to prevent transmission by asymptomatic persons with the infection. Now, I'm convinced that these recommendations were made with the best of intentions, based upon very limited information available at the time. You know, the opinions of the trusted experts. Well, the experts had their way. Now, in the United States, a significant portion of the population is terrified about the prospect of catching this virus from someone who would appear to be perfectly healthy. People were even being arrested for not wearing a face mask. Can you imagine being arrested because you didn't wear a face mask? Well, guess what was just announced? An expert at the WHO just announced that asymptomatic COVID-19 spread was deemed rare. Wow. Whoa, but wait a minute. That's already sort of been retracted. Well, you see, if you get into it, it's really because we have to act on what the modeling study says. Well, let me explain. Dr. Maria, the World Health Organization's COVID-19 technical lead, made a comment on Monday. Based upon her review of unpublished data of a few ongoing studies, she had said that it now looks like asymptomatic transmission was very rare. Needless to say, that caused an immediate PR problem for the WHO. So a clarification has already been issued. You see, while Dr. Maria maintained that real-world data suggested that it could still be a rare event, she was not referencing the modeling studies when she spoke. So her comments at the WHO's Monday press briefing about its rarity was based on 2 or 3 studies following up the contacts of asymptomatic people and unpublished data. So it seems that until proven otherwise, the official position of the WHO is that modeling studies estimate that up to 40% of coronavirus infections could be transmitted by people who have the virus but no symptoms. Remember, the operational word is could. And the counterpoint is, and maybe not. Anyway, Dr. Maria's final word on asymptomatic transmission: we don't have the answer yet. Well, when you review the recently updated WHO recommendations, you will find this admission. Quote, at present, there is no direct evidence from studies on COVID-19 and in healthy people in the community on the effectiveness of universal masking of healthy people in the community to prevent infection with respiratory viruses, including COVID-19. So what's the bottom line? Well, in the scientific community, some researchers say, quote, any healthcare intervention must be evaluated for its clinical efficacy and effectiveness in well-designed random controlled trials before it is implemented in clinical practice. However, in this case, we have a world in a state of panic based upon a premise for which the WHO admits there are no RCTs, and thus by some standards, no direct scientific evidence. And for this, people are getting arrested? Do you wonder why people are losing trust in the so-called experts? Are you beginning to understand why people are losing faith in the system and don't know who to believe? You see, if you question the status quo, you're criticized for not having an RCT. But if you support the status quo, all you need is an expert opinion. Does anybody besides me see the hypocrisy in some of the statements that are coming from these so-called experts? Well, that's my update for today. Tomorrow, we will continue our journey in search of the truth. Meanwhile, make sure you visit the ICA COVID resource page and review the new WHO guidelines. Now, make sure you look at page 6, column 1. It's about 2/3 down the column, and read it for yourself. Anyway, please reach out and connect with the ICA. We're here for you to help you help your patients, because they need the reassurance that there is no need for mass panic. And don't forget, you are truly their beacon of hope, and we will get through these challenging times, and we will do it by working together. Thank you.